All right. So, hi everyone again. My name is Najuko Joanita, and I am part of the Nawi Collective. For those of you joining us for the first time, Nawi is a Pan-African feminist collective working at the intersections of economic justice and feminist political economy. And a lot of our work is concerned with how economies are organized, whose labor is recognized and whose labor is erased, and what it would mean to build systems that sustain life. And through this Labor Month series, we are collectively thinking about how labor is being reorganized in this moment of crisis, and what really that means for workers, for movements, and for the possibilities of more livable futures. And our first session that happened last week helped us think about the wider state of power within the global and African political economy. So we talked about things like the rise of authoritarianism and repressive governance. We talked about the growing power of corporations and big tech and how labor is being reshaped through all these forces. And today we will be unpacking what these shifts are meaning for our daily lives and how they are being lived by women, by queer people, and marginalized workers. And today's conversation will reflect on what it means to work and survive when livelihoods and rights are under attack. And with me today, we have 3 speakers, and I'll introduce each speaker briefly and ask them to share a bit more about themselves, what they're up to, before they get into their reflections and their presentations. So our first speaker is Wangui. Let me just pin. Give me a minute. So Wangui, you can introduce yourself briefly and, tell us what you've been up to lately.
Thank you all. I really appreciate the invite to be here and to learn from all of you. I'm based in Nairobi. I'm a researcher and I'm affiliated to both the African Center for Cities at the University of Cape Town and American University Abroad program. And broadly, my research for the last, maybe I would say 15 years, thinks about urban justice issues, but is increasingly interested in thinking about what it means to be African in this geological age of the Anthropocene, or basically in climate change. How are we responding to climate change? What are the different embodiments that articulate this from the African body? And I think I'll stop now. Thanks again for the invitation, and I look forward to sharing with you shortly. Thank you.
Thank you, Wangui. Teto.
Good afternoon, everyone. Thank you so much, Janita, for this incredible space and incredible work that Nawi does. I'm Teto Mahlakwana. I'm a South African-based political economy strategist. I work in the intersection between politics, governance, labor, communications, media, and the economy. And at the heart of that is naturally the workers and community for whom policy must translate into action and for whom these policies that we imagine and research and draft are meant to equal an improved quality of life. And it's been such an incredible journey observing in the past 18 years the shift that has occurred, but it's been a shift that, of course, necessitates spaces like this, and that's why I'm quite grateful to be a part of this forum today. Thank you, Janita.
Thank you, Teto. And lastly, Fatima.
Hi everyone. My name is Fatima. I go by they, them pronouns. I also use she, her pronouns. I am a queer African feminist writer. I'm a community organizer, and I'm also a storyteller. I'm based in Accra. And most of my work is geared towards the liberation of African and Afro-descendant people everywhere, but especially queer and trans people. My work seeks to bridge the gap between African feminist movements, but also LGBTQ women's organizing by centering queer political analysis and the experiences of LGBTQ women and gender expansive people in African feminist thought and activism, but particularly around issues of gender justice, economic justice, and digital justice. I'm really honored to be here, and I'm looking forward to co-learning and co-sharing with everyone. Thank you.
Thank
Maybe I can share my slides. Oh, there they are.
friends. I'm so sorry. The internet keeps, doing the things it does. But Wangui, I'll hand over to your very capable hands.
Can you hear me okay?
Yes, I
Thank
can.
you. I don't know how capable my hands are, but I will try. Thank you. So I hope you can see. Can you see my screen yet? Or am I just sharing? Okay, can you see the screen? Thank you. Fatima says yes. So I'll proceed. So thank you all for being here. I'm really grateful to be here for the chance to talk about an amazing, really incredible group of mostly women who Kenya used to refer to as community health volunteers, but now refers to as community health promoters. And so this research is informed by research I've been doing for about 15 years in really quite struggling and I would say systematically oppressed spaces in Nairobi, in Mathare. So it's informed by that. And in that work, in that ethnographic work, I ran into and made friends with a lot of community health volunteers or promoters. But it's also informed by the reality that, and building on the work of critical science and technology studies scholar Ruha Benjamin, that in this time where we find ourselves, in this Kenya that where we say we want to be the Silicon Savannah, or we are, and all of this techno optimism, that there are people who are fixed in place in order to enable this techno scientific development. And so, really capturing this, and again informed by the work of Ruha Benjamin, it's these two kind of phrases or questions that motivated the work I did with community health volunteers, and that informed my presentation today. You can see them on the screen, and Ruha Benjamin asks, who and what are fixed in place, classified, corralled, and or coerced to enable techno-scientific development? And I think this is a really important question, again, in this time of vast techno-optimism. Ruha Benjamin also adds, sorry, I'm trying to move my, my own face. Ruha Benjamin also says, visions of development and progress are too often built upon forms of social and political subjugation that require upgrading in the form of novel techniques of classification and control. And so these visions of development and progress in the health sector are what I talk about in this presentation, and also informed by this paper that I did for NAWI. And we will see how whether these novel forms of progress, I mean state progress, they really do build on earlier forms of coloniality, on gendered coloniality above all. So I make two arguments, and I think I'll just take some time to go through them. These are arguments I make in the paper, but that I'll also make over the next 15 minutes or so. So in this paper, I chronicle how health workers or promoters or often volunteers, the role they play in contributing to a digital and data age that exploits their dedication to their communities and transforms both their workloads and the nature of their voluntary work. So in the following minutes, I hope I make clear how their workload is exacerbated or really increased by this need to become data producers. And so the nature of their voluntary work often then becomes less about the care and the social reproduction of their communities and more about producing data. The second argument I put forward is that as Kenya pursues these technological developments, it is these women, primarily poor, urban, and rural women, who are fixed in place to allow for scalar advancement. And I think it's important to emphasize that it's scalar advancements, not just at the scale of the state in Kenya, but also for larger multinational organizations. So they allow for advancements in the provision of state-delivered medical attention. Here, in these processes, the benefits of this data accrue elsewhere. It doesn't come back to them financially because, as I will talk about, they're barely, if at all, remunerated, and it doesn't even accrue in transformed healthcare provision. So ultimately, they're just exploited to collect data, and none of the benefits accrue to them, and the exploitation worsens. So those are the arguments I'm making today. But first, what's the context? And I hope the term community health promoters is not so foreign for our audience, but it's really frontline, and I'll define them shortly. Frontline community volunteers who are given the task to go and check on pregnant women, record cases of tuberculosis, for example, refer people to medical facilities. And they exist, it's important to emphasize, because of systemic failures of healthcare provision. But what is the context? That in Kenya, we have 107,000 community health promoters. This is almost as much as the total number of doctors, nurses, and clinical officers combined. Really, I think it's worth remembering that. I think for the WHO, ideally, if I'm not wrong, the doctor-patient ratio should be 1 doctor to 1,000 people, but in Kenya, it's 1 doctor to 17,000 people. And so community health promoters fill in this gap. I'll just change the slide. And community health promoters, according to the Ministry of Health, are trained, although I'm not quite sure, but they're trained members of the community who work as a link between the community and formal health facilities. Community health promoters play a crucial role in addressing health inequalities by bringing essential health services closer to the people, especially those in rural and undeserved areas. Further, they act as a link between the community and formal health facilities. So this is what the Ministry of Health says. But in reality, community health promoters are people often who already have a leadership role in their community and who are seen as having the passion and the care work already established to support community health needs. They are not always trained. The ones I know are not, they're what animates mostly is their passion rather than training, although they have been known to give polio vaccinations, etc. And here, whereas the Ministry of Health saying they play a crucial role, the conditions that they work, oh, sorry, am I talking too fast? I completely forgot about translation. Sorry, I'll slow down. But the conditions that they work in completely belie this ostensive crucial status that the Ministry of Health is saying. And whereas they are often seen as emerging from the it was called the Alma Ata WHO conference in 1978, or Kenya's bid for universal health coverage. In reality, and here I support what Prince says. So sorry, that's them, first of all. I'll just make sure that I'm speaking slowly, sorry. In reality, even if there's this genealogy traced of them coming from this WHO conference in 1978, in reality, I support Prince's analysis when they say their emergence is more indebted, however, to the effect of structural adjustment policies, the lack of resources for supporting health systems and professionals, the huge demands that the AIDS epidemic made on the capacities of hollowed out health systems, and the NGOization of public services. Ultimately, community health promoters emerged from the neoliberal preference for service delivery on the cheap. So this is how I see them emerging. And so whereas a little bit to contextualize their conditions, here are two quotes from the paper that I did for NAWI. So these are quotes from community health promoters who I interviewed in 2023. And you can see from these quotes the real dire conditions that they're working within. So one community health promoter says, people say, go call your car, and you don't have a car. Here you have no gloves, no masks, umbrella, bag, no gumboots. And then when you go to the hospital, you can't even get Panadol. Another says, you go and take someone to the hospital, you have closed your business to take care of someone, and you have no gumboots in the rain or shit. And so these are the conditions that people are working in. Now, holding this constant, we have a lot of, I don't know if the word is whitewashing, about the realities they face. More recently, and in this case, I know AMREF does good work, but in this case, AMREF talks about how, you can see from this quote, for years, community health promoters worked behind the scenes as volunteers, often without pay, supervision, or tools. They served with heart but lacked recognition. That changed in September 2023 when Kenya took a bold step at a national event presided over by William Ruto, also known in Kenya as Masgo. Sorry, that's a sidebar. The government distributed 100,000 digital kits and smartphones to community health providers across the country. This, they say, was more than a ceremonial gesture. It was a turning point. I personally don't understand how, while community health promoters are working in conditions where they have no gumboots, no gloves, no pay, how receiving tablets and smartphones is a turning point. But I think here for me, it indicates not only the datafication of health, but really the exploitation of these workers in extremely poor conditions to become data producers. So the reality, and I know I don't have much time left, I'll try and bring this to a close. The reality that I found in my work was that And why I call them the exploited labor of Kenya's digital health age is because they have completely untenable conditions. You saw no gloves, but here you are being handed a smartphone. They're barely remunerated, if at all. They earn, when I last checked, when they do earn this, at most $35 a month. And this, to make it worse, this income is subject to deductions for national health insurance, which they're not even privy to. So they face deductions as a healthcare workforce. They face deductions for what is now called the social SHA, the social health, whatever it is now, but the hospital insurance. But they are not privy to this health insurance. When they go and try and access it, it's not there. So if they get sick, as they can in the front lines of this work, they are not. No one cares about them. They don't have access to health. And I think this was especially evident, tragically, during the COVID period. The reality is also that their labor far exceeds their job description. So whereas they're considered by the Ministry of Health referrals to health facilities, they also end up being activists. They end up being mothers. They end up being leaving their jobs, as you saw in this previous quote, to try and help community members because they're committed community, whereas their JD just doesn't really reflect the vast, extensive care labor that they do and that they're exploited for. And relevant to this, they are forced to collect data, and I'll talk about this a bit more in subsequent slides, but they have no idea where that data goes. And sometimes they are forced to make up these numbers. So they all have, and in the document, in the report that I wrote for NAWI, you can see an image of the book that they have to fill monthly. So they fill information about how many pregnancies they attended to, what cases of tuberculosis, cases of HIV, etc. So they're forced to fill this. Even those without smartphones or tablets. But when the numbers are not deemed satisfactory by an intermediary manager, then they're forced to change this. And so consequently, intuitively, they know that others are fundraising with their data and their care work is exploited and burdened by these data developments in the health sector. So this is not just something that I have found. The work of Mukungu and Dodworth and Olunga speak to this in a recent policy brief where they say CHVs reported, because of this increased datafication of their work intensification, as well as new digital pressures, what this policy brief is calling techno stress, because instead of being a human interface or being the human who does this work, they now have to also deal with notifications, surveillance through this instrument, reminders, and intensive performance tracking. And it's changing their health work. Instead of someone being there, although exploitatively, but someone being there for their community members and investing in relationships, now this is increasingly skewed. This work is increasingly skewed towards data production. And so ultimately, Mukungu and Dodworth found that community health volunteers are now data producers in a larger ecosystem that doesn't translate into any support, doesn't translate into their improved healthcare, doesn't translate into improved healthcare for their own communities. And this was corroborated by when I interviewed a senior data specialist in the Ministry of Health, when I asked him, okay, I mean, it's in my opinion, it's very clear that they're just data producers. This is not something he denied. And he said, ultimately, and this datafication or this increased collection of data is something pushed not so much by the state, but by other actors, whether it's international NGOs or other states who know, as he said, in the next 15 years that big data, longitudinal data is better. So in 15 years, they will have better data for AI, which the government does not have, as they don't have that data. The people who are the forerunners in this data collection was not the state, really. So whereas perhaps in the long run, this data can help in forecasting or visioning, at the end of the day, they don't own that data. And they were not it was not their actions that motivated this data collection. So by way of conclusion, these are the conclusions I make in this work, that when the state capitalizes on the reality that community health promoters will serve their communities without any or adequate compensation, these workers become those who are fixed in place, as Ruha Benjamin says, for technoscientific development. Oh, sorry, I'm not done. For technoscientific development in the Kenyan health sector to occur. And this, as Coldry and May has talked about, builds on the coloniality of data, as Timnit Gebru also points out, built on very unequal relationships. And so when this is manifest in the Kenya health sector, we see that it is those who are already exploited who are further exploited by this increased data collection or bid for datafication. This progress generates income streams for state at best, but mostly non-state entities and non-local state entities without enabling any transformation in the work conditions of the CHPs who don't have gloves. They can't find Panadol in the hospital, and they don't even have healthcare. But still now they're increasingly surveilled to fill out these templates and are increasingly surveilled to become data producers. Finally, in my conclusion is that for CHPs, and I know in other sectors, Africa continues to be a laboratory, and their committed labors of CHPs, so the committed labor of CHPs for their communities are further corralled to support these unequal technoscientific experiments. Thank you so much, and I'll stop now.
Thank you, Wangwe. I'm trying to look for you so that I can pin. Yes. Thank you so much, Wangwe. I think you have really brought to light very important aspects, and I think a lot of us in African countries can relate to the important work that community health practitioners play and the role that they play within public health systems, especially within rural areas, because they're the first point of contact or even only point of contact. So it's very important that, their work is visibilized, but also that the rights and the conditions within which they are working are made better by government and public services. When you talked about the issue of gloves, I remembered a documentary, or one of those documentaries that BBC does recently around Pakistan, and how community health practitioners had to recycle gloves and injections because they don't have enough. So what does that mean for the health of, the population? But I will leave it there for now, and we'll come back to you because I know you triggered a lot of conversation. So I'll hand it over to Teto, and Teto will be speaking to us around how workers are experiencing this current moment of deepening political, social, and economic insecurity that, a lot of us can relate to. So over to you, Teto.
Thanks, Janita, and thanks to everyone on the platform. I prefaced earlier that the work that now is looking into, not only this month but generally in the political economy, is really important. And it's important through 5 pillars that I will address in getting at the heart of what is happening with these workers who are precarious and what organizing methods they have been exploring. And I use the word exploring quite emphatically because a lot of it is still at really early stages. And what traditional organizing has been or is to this group of workers, and ultimately find a way of how we move forward. Now, we speak of this moment, and everybody in every space keeps talking about this moment, and I always sit alone and say, but is it still the moment? Are we still in the moment? Because we were there when the International Labour Organization commissioned the Future of Work study, which was co-chaired by two presidents, one of them being the South African president, Cyril Ramaphosa, and they came out with this 200 plus pages of a report which said that the future of work must be human centric, that no one must be left behind. And we used all the wording and the terminology that we know, that it must be just, that there must be protections, that there must be policy, there must be governance to guide and regulate how this future is going to manifest. Yet the future is now the current, and the current has proven a number of elements and a number of truths which we are still struggling to come to terms with, by and large. The first one is that the future of work did not arrive in a silo. It did not come and establish itself as this new system of existence for workers, or this new system of I guess compliance for employers. It arrived on an already stressed workforce across the world, especially in Africa. It arrived on an already unrecognized workforce by policy, by legislation. It arrived on top of years and years of proven regression in the realization of labor rights and human rights broadly. It also arrived on top of what we understand and know as a flattened exploitation base, where exploitation has been given metrics of acceptability, and where we tend to say, oh, but that's really bad, when inferring to other forms of exploitation as though they do not all fall under one basket. So that's what the moment is. The moment is a crisis, and the theme that now we chooses is quite poignant, that we are in an age of crisis, and the crisis does not birth itself. The crisis is a consequence of generation upon generation of work that is left still, work that does not happen. Now, the most important thing that I want to draw home to everybody on the platform is that, so this young mother who takes up platform work, say they are a domestic worker who is reliant on an app to order their services, is still the same, mother that the speaker before has described as having to deal with care work, right? Unpaid care work. And it's still the same mother who was abused in the household and abused in society. And now that abuse moves to technology facilitated gender based abuse. So a lot of what we're experiencing is not new. And that's why I say that when reflecting on what the moment means, we must do so with an understanding of the narrowing of the complexity of it all. That at the heart of it, there is a system, and the system is called capitalism. And at the heart of it, there is a system that is trying to counter what capitalism brings as in the negative, which is called activism, which is called organizing. Now, how workers have been, communicating is also quite interesting. Firstly, the level of transparency and the level of openness in activism spaces, which would birth really strong voices, is disappearing. That's simply because workers who are in this precarious state live with the daily knowledge that their communications, firstly, are being monitored. Secondly, even if it's a private device or they deem it private, the system has entrenched within them an insecurity that says that everything you do is monitored. Therefore, even their terms to organize become quite difficult. Now, this group of workers then come into the labor market and they exist in the labor market. And we can all sit here and go over the issues they have around abuse, around exploitation, around surveillance, around, it's a number of them. And a lot of them, of course, are still misclassified in policy and in consideration of how to legislate. And they go into traditional organizing spaces, and those would be your trade unions, those would be your staff associations, which is, of course, a thing of the past for this kind of a worker. And they go into spaces where activists have organized for a long time. When they arrive in those spaces, they find a number of issues that they struggle to firstly contend with because they are sort of an oxymoron of their reality. Their reality is that they don't have a physical workspace, and the union will say to you, "But where's your workspace? Because we need to appoint shop stewards who are going to be your sort of your agent and your protector." And obviously, at the absence of that physical workspace, then the worker goes back to their corner and says, "But how do I even begin to exist in this space when I'm not even being seen as a worker?" And organized labor is guilty of that. So platform workers, of course, are called all of these things, which you know that in reality just comes down to you being a worker. You're called an independent contractor. You're called a labor brokered worker and a whole lot of other names, but ultimately you are a worker. And when you go to a trade union, you don't go there saying, I'm expecting a different form of coverage. You go there saying that I expect that my rights will be protected. And their issues, unfortunately, unlike the formal workspace, are issues of survival. They're issues of everyday survival because they have to deal with contracts that are really fluid. They have to deal with unpredictable income. They have to deal with unfair allocations of shifts. They have to deal with wage theft, which is a big thing of our generation, where even the contributions that are supposed to go to your pension savings do not go there because your wages are being stolen from you in real time. Access to social security, they do not have that. So this ability to survive week by week, day by day, then becomes the preoccupation of this new worker. And again, I use the word new quite, I guess, generously because it's not new like I demonstrated in the beginning. So then you come back with your issues and you say, okay, so I still have this bag of issues. And that trade union office is asking me about a shop steward and about a work office, about a supervisor. I don't even know who my supervisor is. All I know is that there is an app that comes up or a prompt that comes up to say that I'm working slower today or I have not recorded as many rides today as I should have. I do not have any of those. Then that immediately impedes your safety and dignity, that I don't have an outlet. I don't have a place to go when I face sexual harassment, when I have to deal with issues related to unsafe transport, to customer abuse. And it's one of the things that I've been obsessively looking at how we have this transition from telecommunications in the sense of call center agents who now have to consume not just the technology facilitated abuse, but consume actual everyday frustration and anger as the cost of living multiplies and quadruples for a lot of people. And you have to now deal with, of course, racialized exclusion, disability exclusion. You have, when you're queer, you have to deal with the discrimination that comes with it and the consistent fear of retaliation. Then it also becomes a digital justice issue that when you bring your complaints about, say, maybe some opaque performance system that has been implemented to govern how you work or guard how you work or discipline you, then the trade union does not even understand that language because there's this big divide between what they do in the formalized sense and what your work looks like. Now, what does that worker do? It brings us to the other aspect of the work that we are undertaking today and the theme of I'm addressing to say, why are these traditional workspaces struggling? They're struggling because even before the new form of work arrived, they were struggling for legitimacy. And there is a fair question and a fair assessment. Enough research backs it up that there's always been this contested power within the organized labor movement itself. And that contested power, of course, goes into the workspace where unionists position themselves for certain favors and for certain elitist perks and so on, removing completely that legitimacy. And we see this in the lack of numbers that are really formidable in the organizing space. In South Africa, we're sitting at somewhat 25 to 28% of workers who join unions. Is even lower when you go across the continent. Kenya is significantly higher in the formalized sectors. Actually, it's Ghana, not Kenya. Kenya is quite much lower. So you have this low unionization rates, which have always been a crisis even before we had to deal with this precarity of work. Then you have this assumption of a visible employer, right? And I saw this recently while I'm working with a labor federation in South Africa, which is trying to break into the platform economy organizing space. And one of the biggest challenges they had was they could not collate a meeting, a simple thing as that, because everybody works different shifts. So these workers have begun communicating among themselves to create systems and to create some sort of synergies that would see them step out of just this narrow organizing amongst themselves, but also go and seek a larger umbrella trade union or a larger umbrella workers association that can cover them. But then they have that challenge that not only is the language misunderstood, but also capital has been so strategic in embedding itself in the trade union movement itself over a period of time, which has meant that it has weakened in its resolve and it has already just taken the technology issue instead of making it a literal worker issue in a policy framework where trade unions want to, for example, comment on regulations, comment on what happens to technology policy, but not necessarily the everyday worker effect of it. Then we ask, what does organizing look like for these workers? Because, like I said, they're not passive. They're sitting there because they have a lot of questions that they must answer. They have a lot of dependents that firstly need coverage from these very questions that must find answers. And we find this in the following formats, right? That they are organizing digitally, which is quite important. And it's something that workers have been quite open about, that if we can work in a digital space, then we can organize in a digital space. But like I said, then there's always the threat of monitoring and that you are being watched over by this employer. So you're not going to look for a classic union. A lot of them have given up from that idea that they could join a classic union. So what they've gone to do is organize in hybrid structures to say that if you can meet in a physical format, let's try and organize other people in a different format because we know that our structures are not really physical or even limited to one location or geographical space. That they emphasize that they want to be considered as workers as per the legislation that governs them where they are, as opposed to what their contract says. And this points to a very poignant thing, and the fact that they themselves know that their contracts are designed to betray them and to take away the little rights that they may have. Then you have those workers who say that, but we must then redefine who counts as a worker. And a big part of that work that has happened in South Africa is that now in the what is considered the most significant review of labor law since the democratic dispensation over 30 years ago, is looking at how do we define what an employee is. So, in our advocacy work, we must demand of our governments and of our policymakers and lawmakers that we must go back to the definition of what a worker is. Because if we are going to follow what contracts say about platform workers and about other technologically centered work forms, then these workers are going to be deemed as self-employed when they are workers. You cannot be self-employed when you have no control over your wages, when you have no control over your hours of work, when you have no control over even the protections that govern that work. How are you then self-employed? Which is what the independent contractor label brings. And this labor law reform did not come out of the ether in South Africa. It came out of a lot of organizing work. There's an office called the Casual Labor Office, which has been doing a lot of work outside the limelight, which has been dropped by unions. And I am quite conscious of the fact that I am saying that trade unions had dropped that role because trade unions became obsessed with the formerly employed and forgot about all these other people on the margins and the fringes of the economy. Then there's another axis that these workers want to look at, right? And they want to look at how labor process and the real power structure intersect. And they're aware that the real power structure does not sit with the algorithm that governs their work. They are aware that the real power structure does not even sit with the trade union that they knock on whose door they knock. They're aware that it sits with lawmaking, which is quite a beautiful awareness to have, which means that you can lobby your parliamentarians, you can lobby whoever it is that represents your constituents, whether you're a waste picker, whether you're an e-hailing driver, you somehow have a cognizance of who it is in your community who is responsible for what. However, even that is not as clear and easy as it should be because for a long time, work has been taken outside of the community, meaning workers have been pitted against community for a long time. So much so that they don't see themselves as part of community, which is another stumbling block. That when you speak to workers and say to them, but you can always go and lobby for this position to be prioritized in parliament or in any other policy legislating space. And the immediate thing would, of course, be, but who do we go to? Because workers, like I said, have been removed from society as a consequence of the dropping of important issues by set sectors. So in conclusion, I want to go over what it is that can happen that must change. There's a lot that must change naturally, and the problem doesn't is cannot only be located in the traditional organizing spaces, but it must also be located in the broader political economy. We used to exist in spaces where for every policy formulated in the labor market or economic development chambers across the continent, there would be the voice of organized labor. Organized labor would not have a color, it would not have a creed, it would not have a status, it would not be formalized, it would not be, it would just be a voice that is able to collate itself and organize itself as a grouping and find a common vision around what it is they want to see manifesting. However, that voice is no longer there. And as a result, we have a challenge where collective bargaining has been reduced to an individualized form of communication or even form of negotiation, whereas it used to be a sector-wide and it used to be modeled around legal support, around community-based branches, and that's where we need to go back. We need to go back to the heart of what organizing is, and organizing does not have a job position. Organizing has and a will at heart, and the will says that I want to realize labor rights for myself and for my colleagues, and that's all it's going to take. Whereas now it's different. What position do I hold? Do I have the right to speak? Do I have the platform to even speak? So there needs to be that cognizance that defending these labor rights must, of course, also mean that we're defending democracy, because if you cannot realize democracy and the power thereof um, in your solitary space of work and in your home space, in your community, then you're not going to realize it anywhere else. There must be this balance that we strike between access to justice, to social justice, to rebuilding this worker power, and doing so as a democratic project, as opposed to this idealistic, thing that we imagine is going to happen because the informal workplace is not outside of capitalism, and the enemy remains one. It's capitalism, and it has organized itself more efficiently, yet those who are protecting themselves from its negative effects are doing so in a disparate and very disconnected manner, and that's what we need to fix. I'll pause there for now, and hopefully we can engage further on these topics as we go into the Q&A. But my emphasis is exactly that these are not new things that we're dealing with, and the sooner we come to terms with that, the better for all of us. Thank you.
Thank you, Theto. I'm going to assume that you're done because I dropped off at the last moment because internet. Any small clouds that form, then suddenly, yeah, the internet.
I had just concluded, Juanita, and I had just invited colleagues and comrades on the platform to think about how this is not a new place. We have been here before, and if we take a step back to some 20, 30, 40 years ago, you'll realize that workers have been here before, and we may need new tools, but we don't need new ideology. Thanks.
Nice. Thank you, Teto. And I think it's quite important, some of the reflections that you have shared, because a lot of our work and all of us who thought, we have security in terms of work, we are seeing shifts in terms of contracts becoming more short term, and a lot of our work becoming precarious. So it's important that we are aware and cognizant of the changing nature of work. And so this work is not to be left to only trade unions. But I see Ghislaine here who will encourage us to join trade unions as well. But yes, so many reflections that you have shared that I've been writing down. And I think in the time for the plenary, I will also share more thoughts and more questions. But for now, I will hand it over to Fatima, our last speaker, who will really help us unpack and explore what this moment of anti-rights means for queer workers, for the different gender dynamics that we face or that we know. Over to you.
Thank you. Thank you, everyone. Let me just open my notes. All right, thank you, everyone. First of all, thanks to Wangui and Tito. I hope I'm saying your names right. Thank you for your really great interventions. We have heard from you about the often invisible but yet life-saving role that community health volunteer workers play, even while still working in the exploitative conditions. And we've also heard about the issues that workers are facing within the current economic context, and we've heard about the intersections between capitalism and gender-based discrimination and violence. And from the interventions that we've heard today, it's quite clear that the question of who gets to work, under what conditions, and with what protections for their bodies, and also what protections for their identities, like all of these things are crucial to the labor question. And it is within this context that I want to situate queer and trans people, and also sex workers as people and as workers who are part of the group of workers that we talk about when we're talking about workers. And also as people who also situating queer and trans people and sex workers as people whose identities and whose labor are then further invisibilized due to homophobia and transphobia, which we find that is often perpetuated by the states. And so when we think about labor and we think about the rise of AI and digital systems and all these things in the world of work, it's easy for us sometimes to think of them as separate from the struggle for bodily autonomy, or we think of labor and AI and digital systems as separate from the global rollback of gender and queer rights. However, if we look at anti-gender politics, we look at anti-queer politics or anti-sex work politics, we find so when we look at these anti-gender, anti-queer, anti-sex work politics, but when we also look at the algorithmic systems or the digital systems of work, we also find that they are very capitalist and they are very patriarchal. And we will find also that these politics, these anti-rights politics and these, oppressive systems, they are all governed by the underlying idea that gender and sexual identities that deviate from what capital and what conservative power structures consider as productive, right? Like if your gender or your sexual identity is deviating from this, then you should not exist in the economy, right? So that's kind of like the underlying idea. But yet we also find that the issue of sexuality and bodily autonomy is not separate from the conversation of labor, and we should not separate it actually, because the issue of sexuality and the issue of bodily autonomy with regards to labor is also the struggle of, say, for example, someone who is a junior level officer, let's say in a marketing company, who is getting sexually harassed by her boss, and we find that she doesn't have any anti-harassment protections at the workplace, is not part of a union, so does not have any union backing. And so it's either you endure the exploitation, or you quit your job and then you expose yourself to economic precarity, right? We also see that this issue is not separate, because when we think about the struggle, for example, of a young trans person who is working as a shop attendant, say somewhere in northern Nigeria, the identity is criminalized, and the employer knows this, right? And so you're overworked, they're underpaid, they're maltreated, and you can't complain, you can't do anything about it, because then if you do, your employer is going to report to you that you're a trans person in the workplace, and you're going to be arrested, you're going to be thrown in jail, or even worse, you might be killed, right? And so even from Teto's intervention, we hear about the moment that we're in. Capitalism is ramping up all the mechanisms, and we're seeing the effects like across our communities. We're also seeing all over the continent, but also in recent times, specifically in West Africa, in Ghana, in Senegal, in Burkina Faso. We are also seeing that anti-LGBT laws are, on the rise. It's either they're being introduced, or there's a threat of them to be introduced, or, things like that. And we're seeing all of these things happening. And I think that I would really like to make it very clear where these laws are coming from and who is orchestrating them. And it's, it's the anti-rights, anti-gender, anti-sex work, anti-feminist movement, and they're made up of organizations like Family Watch International, World Congress of Families. They're organizing, they're rallying, they're getting MPs and political leaders and government to implement some of these laws, right? And what they're doing is these laws are being implemented to deny the humanity of queer and trans workers, to say you're not people and you should not exist, right? Because when you look at across all the countries, you look at the context or the text of these bills, it says things as who you are as a person. For someone to be queer or trans, that's illegal, right? What does it mean for us to say a person in their personhood and their full autonomy and their full everything is illegal, right? And so if someone is illegal, we're saying they should not exist, as a citizen. Then it means we're also saying that they should not exist in the economy, right? And we're also seeing again the gender movement. They're also pushing all these like very traditional understandings of gender and family. We are seeing, for example, on social media, the rise of trad wife content, people making this type of content of how they're living their ideal best life because they're not working, they're at home, they're cooking, they're making cereal from scratch for their husbands, and they are also promoting this idea that somehow it is like it's revolutionary, right? But also that like feminists have done something wrong to advocate for women to be paid for their work, because first of all, they misrepresent what the issue is. They say feminists are making women work, but that's not what it is. Women have always worked. Feminists are only demanding that women are paid for their work, right? But then we're seeing this of the trad wife content where it's like, okay, people like, women should be at home and cook for their husbands or partners or whatever, but also having a lot of kids. And we think about when we think about this, even in the context of anti-rights movements pushing these very traditional ideas of gender, but also reproductive labor, it's like we're also saying, women, we don't want you to participate in the economy, but also you must have more kids to produce more workers for the workforce. And so I just wanted to make all of these connections, but also to show how this is a labor issue. Because when laws are enacted to erode legal protections for women and for sex workers and for trans and for queer people, what you do is that you create a class of workers who have no recourse, right? Because if already you don't exist in the law, you don't exist in the economy, and you've been invisibilized, so much so that the only thing that people can see is your outputs, but not you as a person. When you are experiencing abuse, for example, in the workplace, and you're being exploited, you can't even report. You can't even organize, right? Because for you to be organized, for you to organize is for you to be visible. And it means that you're only going to put yourself in danger. You might be arrested, and you might be thrown in jail, or even worse again, you might be killed. Right. And so when we exist in a context like this where such things happen, what is also happening is that because power is being taken away from the hands of queer and trans workers and also sex workers, that power that is being taken is going somewhere. It's going to the hands of employers, and it's going into the hands of corporations, and it's more power to exploit. And this is the thing that is at the crux of the labor issue, all this power to exploit people, and they get nothing in return for it, right? And so I just kind of wanted to, first of all, make these like connections between the moment that we're in with the anti-rights, anti-sex work, anti all these things, and also the connection to labor and why labor movements must organize together with queer and trans people and also with sex workers. I want to talk about bodily autonomy and labor. And when we talk about bodily autonomy and we talk about labor, we also need to name sex workers as very central to this work. Bodily autonomy, it influences who gets to work, on what terms are you working, and also for how long. Why? Because the right for you to control your body is foundational, or it's fundamental to the right to work, right? Because we engage in work using our bodies. And if you don't have control over your body, you don't have control over your labor. If our bodies are endangered in some way or the other, our bodies are physically unsafe, or our bodies are criminalized or forced into reproduction. You don't want to have a baby, but because of anti-abortion laws, you have to have the baby. When all these things are happening to you, whereby you can't control your body, it also means that you can't even control your labor. You can't control how you engage, in work. And so if someone is controlling your body, whether it's the state, whether it's a corporation, they're controlling if you can work or if you cannot work. They're controlling when you can work, how you work, where you work, what you do for work, and all of these things. And we've seen this historically, right? We've seen it play out, even in times of enslavement, where enslaved Africans, you have no bodily autonomy because you've been enslaved. So somebody owns you, they own your body, and so they own your labor, right? And also, even when we think about it now in contemporary times, or the times that we're in, with the spread of like anti-abortion and anti-sex work policies and structures, if the state forces you, or forces a woman, or forces a pregnant person to carry the pregnancy to term, it also shapes your labor participation because you did not plan for this baby. Now you're forced to have the baby. You had to take time off work that you didn't plan. You had all these plans that you wanted for your career and for your personal and professional development, and now the choice has been taken away from you. It impacts the way that you show up, in the economy, and also in work. And so, and we know, right? We know that there's evidence to suggest that when women and, gender expansive people have access to reproductive health care, it enhances or improves their outcomes in life. You're able to be on economic paths that you wish, like you have a choice around that. You're able to be educated, stay in education, plan your career in a certain way, develop yourself, and all of these things. So there's that. And then also, even on the issue again of bodily autonomy, we find that sex worker-led movements across Africa, they have also been very clear about their demand, right? They want full decriminalization. They want to have bodily autonomy, right? Because for them, their bodies is central to the work. So they need to be able to own that. They want to be recognized as workers with rights. They want to be protected from violence. Because the work is criminalized, it's like, how are you even engaging or how are you organizing to better your working conditions when the state will not even recognize your work as work, right? So these are some of the things, like we can't, and this is it leads to the point that I'm trying to make with my intervention, that you can't separate sexuality from labor. Like, you just cannot, because those things happen together. And so just also kind of like making the connections even within the current time of AI and digital platforms and all of these things, as these anti-queer, anti-trans, anti-sex work, anti all of these things, politics, are marginalizing workers on the basis of their sexual and their gender identity. AI platforms, digital tech platforms, and all these things, they're also further encoding these biases into the tech systems that decides who gets to work, who is rated well, who gets 4 stars, 5 stars, 1 star, who is ranked high in the search engines, who even, like, whose accounts is flagged for what, and whose accounts gets deactivated, who is able to create content on YouTube and who is not, who gets paid for their content and who does not get paid, and who gets paid more than the other person, right? And we know even now that AI hiring systems are also operating on these existing biases, but they're also amplifying the biases. We've heard examples of how corporations, when they're hiring. Oh, sorry, I've just seen a prompt to please speak slower. Apologies to the interpreters. I'm going to try. Yeah, I was making the point of how we know that some recruiting companies, they use AI systems to filter out candidates. And what these AI systems are doing is they are filtering out candidates based on biases of gender, of race, and even in some cases of of sexual orientation, right? And it's because they were trained to analyze bias data that is already predetermined by these existing discriminatory models that we already talk about. And also this is what Sadia Noble talks about in her book, Algorithms of Oppression. And so we find, for example, Black women would face different outcomes than, say, Black men or white women, or we find that queer and trans people will face different outcomes than heterosexual or cisgender people. And the myth of AI, the myth of tech, and the myth of digitalization that we are in right now, we're always told about all the millions of Africans who are now earning an income through platform and gig work, and how, these tech solutions have changed people's lives, and how it's such a good thing, and it's here to change all of us. It's here to change the future of work, and that this is what is going to save us. But what they don't tell us about, or what we don't hear about, is also the ways that these platforms reproduce gender inequality. So, for example, we're not told that women drivers who are working on the ride hailing platforms like Uber or Bolt, they can earn more when they drive at night, because then the fares are higher, because many people are trying to get rides, and it's surge pricing and all of those things. But night driving also comes with a higher risk of physical violence and sexual violence. And so many women will opt to drive only during the day, because they also have to protect themselves. So what this means also is that their income is going to be affected. And the algorithm does not even notice this. The platforms don't account for it. Nobody talks about it. And it's just nobody talks about it except workers, right? And so it's just that's what it is. But in spite of all of this, we find that sex workers and queer and trans workers, they're not backing down. They continue to organize in spite of everything. And we've heard like different ways of how people are organizing, from Teto's submission. And so as I'm rounding up my submission, I want to conclude by saying that when we have these conversations, when we're thinking about anti-queer, anti-rights, anti-gender, anti-sex work, politics, and all that in the context of the labor conversation, it is worth us asking who is allowed to work, who is protected when they do work, and whose body is treated as deserving of safety and dignity. And we answer these questions by insisting that sexuality and bodily autonomy is a labor issue, that queer rights are workers' rights, that sex workers' rights are workers' rights. And we also find these answers when we're building a movement that includes everyone, not just the workers who are easy to include or the workers who are already visible, but also, and most especially, the ones whose existence is political and is controversial, but also that their survival is at stake. And for them, they're literally in a fight for their lives. And so it is at this point, I'm going to take a pause here and end my submission. Thank you all for all your attention. And then over to you back to
Thank you.
Anita.
Thank you, Fatima. I think your submission had really critical and important reminders that labor is beyond employment and beyond the easier workers to organize with, but it's also about the conditions under which people are able to show up, under which people are able to be safe, to be visible in order to work and exist within the systems that have been forced upon us. So thank you so much for that. I will now open the floor, but just give me a minute to add everyone. Okay. Yeah, so thank you so much to all the speakers. I think a lot of threads have come through and varying perspectives, which, shows that labor is much more than just, a contract and employment. And we've also seen that work and labor cannot be separated from the wider conditions of people's lives. When you talk about violence against women, when you talk about violence against queer people, these issues are all connected and need to be handled together. I think I'm also hearing a lot around digital systems, and not only are they changing where work happens, they're also changing the ways in which this work happens. And so if we are entering this world that is being shaped by biases that are already offline, then we need to be critical about whether this is really the future of work that we need to be fighting for and aiming towards. And I think I've also had around workers who do not fit within existing categories. We hear a lot about informal workers, around platform workers, or unpaid care work. But from Fatima's submission and Teto's submission and Wangui's submission, we see workers who are often forgotten. And so it's important for us to expand our understanding of traditional labor structures. So I'll open up the conversation to those who have joined us. Please feel free to put your questions in the chat or raise your hand if you'd like to share anything with us. Emanuela, sorry, over to you.
Hi everyone. My name is Emanuela. Okay, I'm 19 and I'm a beneficiary of Resource Center for Women and Girls. And basically adding to labor, I find it very interesting the fact that we usually have short contracts and more labor, right? So you find out that the government should be at the line up to support people who are working. And you find out even without labor, young people are suffering a lot, especially like maybe in the family setup, in every setup you can think of. That's why you usually find out your parents is telling you be like this one, your fellow friend is getting money, be creative. So and you're wondering how many people have been creative and yet they're not being recognized in the platform, you see. So it's very crucial. And also I'd also like to add on the government implementing this thing of let's go take our youths or people to go and work outside the country. I just don't see the need of that. I'm not saying working outside country it's bad. It's not bad, but why should you do that and yet your country is able to provide labor, it's capable of paying you see. So I feel like we should push the government more so that they can create that freedom in everything that we are involved in, whether it's in the family setup, in the community setup. Yeah, that's all I have. Thank you.
Thank you so much, Emanuela, for that intervention. I think you raised important issues around government protections and the role that government has to play in terms of creating jobs, creating opportunities, but also ensuring that workers are protected from, the conditions that they are currently experiencing. So thanks for sharing that. I will hand over to Rama. I'm pronouncing that right.
Thank you. Yeah, thank you very much. And I agree with most of the speakers in terms of the labor sector. But again, something that is core in me is recognition of the unpaid care work as work. And I come from Kenya, And we are still struggling with conversations around ratifications of different conventions. Of course, we've had public participation for the ratification of ILO Convention C-180 and C-199 that protects the rights of workers, and to be specific, the domestic workers. And currently, we are having issues around domestic workers being killed at their employer's house, and we're also having issues around the minimal wage. We're seeing domestic workers being paid as low as 5,000 shillings, and this is contrary to the minimal labor standard. So mine is just to hype conversation around amplification towards the minimal wage standards, and also involving employers in these conversations, because we run projects that deals with formation of employers community of practice, whereby we speak to the employers in terms of what the labor requires in terms of the remuneration of these domestic workers, and also just respecting the rights, and also giving domestic workers an opportunity to be trained on budget making processes, and form an agency for them to amplify their key issues during the budget making processes. Thank you.
Thank you so much, Rama, for that. I think this year's International Labour Conference is really critical for the issues that you have raised, because one of the things that are going to be discussed is around gender equality. And so it's important that the advocacy and the work that's being done around that recognizes unpaid care work, social reproduction work, and the work of domestic workers. There's a lot of work that NAWI has written around that, and I'll share the resources in that regard. But I know that also women's rights and feminist organizations and trade unions are doing a lot of work to prepare for a conversation that will happen at the conference. That's, I think, going to happen like in a week's time. So thank you for sharing. Ghislaine? And Ghislaine might speak in French, so if she does, please change to the English channel.
Okay, thank you. Can I?
Yes, please.
Okay. Thank you. I'm really glad to be part of this webinar. And the topic of today is full of my work area at Equality Officer on ITUC Africa. As you know, ITUC Africa, it is the International Trade Union Confederation in Africa. And we are working with more than 118 women committees in 52 countries. This means that we are covering Africa, and the issues that you raise through these panelists today is something that we are working with since many years. But we cannot do it and have a success isolate. We need civil society, we need feminist movement to grow, and also to have a success in our lobby and advocacy. ITUC Africa is really ready to extend knowledge with all of you at national level, because what we are doing today to change, it is what you are talking about, it is a norm. How so far at national level, we update the national rules, law, who existing with feminist men, for equality norms that ILO are helping to promote. We are trying to sensitize, we are trying to train our women and also men to know how we can now look at with a gender lens a domestication and ratification of ILO norm. We are talking about Convention 198, 190, 156, 100, all of these conventions need to be domesticated, understand in national language. And also, we need to ensure that a collective negotiation, a CBA, who exists still at national level with a private sector, involve all of these norms that we are talking about. That is our duty. That is what we are struggling to. And we need to work together. So in Kenya, for example, we have our women committee who are there. We have a strong women who are there who are raising the same issues as a feminist, but we are working isolate. Existing a mean that we can use together to put together our effort, because as I say last time, union are one of the key stakeholders at national level to sit on the social dialogue table with government and employers. We also have another power. The government don't want to be denunciated at ILO level. And we have this power to denounce countries who are not respect a norm, who are not taking care of women as women rights at rights of human in national level. In this period, normally since January, we are requesting a report at national level to denounce all of the attitude, behavior, norm who are not conform to protect workers' rights, women's rights. So let us use this opportunity to raise our voice, to work together and look at updates, national norms, national law, who are not adapted for our struggle as feminists. And as I say, at ITUC Africa level, we are ready to work with all of NGOs who want to use us, and we also want to use you together to put together in solidarity our strength. So that is my message, and I'm still available. Let us come together. We know how to do it. We are not going to reinvent the wheel. And the tools to do that exist. So please, sisters, let us communicate, let us struggle, let us strategize at national level with those who want to come with us, with those who want to work together with us, who are not going to stigmatize us as social movement, feminist, trade union, but let us talk with one voice together. I'm available. And we have some training, we have some module, we have some human resources to work together. Thank you, Juanita. And let's hope all of the things that you present today, it is also in our agenda that we are working on.
Thank you so much, Ghislaine, for always calling us back to solidarity. And I think for those on the call who would like to connect with Ghislaine, she's always willing and available to connect movements of workers. So Ghislaine, you can share maybe your contact if you are comfortable with that. I will hand over to Helen and ask that you keep it a bit short, but also speak slower for interpretation.
Thank you very much. Good afternoon. My name is Helen Apila. I'm a gender expert. I'm just going to speak about two things. I think I'll focus on technology facilitated gender-based violence, TFGBV, because the previous speakers had talked about platform workers. You talked about digital economy and issues around data and the digitalization of work. And increasingly, of course, we see TFGPV as a very, very critical issue that is also affecting labor rights and workers' rights, and without appropriate laws at country level. So my recommendation is that you need to do a bit of research across the African continent or different countries to see which countries have started to develop national guidelines for addressing TFGBV, especially at work. at the workplace. Also, the standard operating procedures. So these documents should be developed by governments. Also, you can look at the UN, the business and human rights. There's a business and human rights forum that also looks at protecting the rights of workers in the private sector, especially among those who are employed in businesses and private sector. There are standards and guidelines that the UN has been asking countries to domesticate. And this should be some of the areas that you could also look at to intersect with some of the researches that you're doing. Areas of advocacy, I would also recommend that you start to engage proactively with the UPR, Universal Peer Review Mechanisms, the Banjul Human Rights Commissions, and the rapporteurs, the special rapporteurs around human rights, especially on women's rights, and also labor rights. Yeah. So back to you.
Thank you so much, Helen, for that information and for the guidance. I'll give Nancy and lastly Clarice.
Thank you. Thank you so much, Anita. The panel has been amazing. I have really learned so much. And what I'd like to probably just chime in and then I could pose, as a question is the points about the speaker, the points around that the speaker elicited helped us to, just elicit discourse around the work of community health volunteers or community health workers, just helped me to think about the state of our movement as well, because I thought about this group as very crucial within our work, as a feminist, as a feminist movement. And what this helped me to think about was specifically how we name labor within our space or within our movement. How do we name contribution and even work that is voluntary or work that is passion driven is also very, critical work. And then it helped me to just sit with, community health volunteers because they are not fully, from what the, presenter was sharing, it helped me to think about the fact that they are probably not fully state workers, they're not fully volunteers, they're not fully activists, but they are, doing very essential feminist work. And it helped me to think about how do we place them within our movement because they are critical, they are the critical force of the work that we're doing. They do critical community level work, community level feminist organizing, but then we do not have a structure that centers them within as a critical movement on itself within our movement. So just centering that. And then also as a young feminist, I of course see myself within this movement as a woman who is probably trying to grow within the space and within the movement. And the way in which young feminist labor is, seen, it is mostly just seen within almost just in close proximity to community health promoters or community health workers. And, our work is usually probably most of the time, based on volunteering or based on, fellowships. And that is how we are engaged within the movement. But then how do we then quantify young feminist labor in terms of probably administrative work that is the engine to feminist organizing work, the emotional care, the emotional labor, who is mentoring, who is traveling, who is translating, who is mobilizing communities. And most of the time, these are, young feminists who probably do this work every day. So probably this got me to thinking about the place of young feminists and the labor that they provide within the movement. Is there a place for it? And if so, can we start to name it boldly so that it can also be adequately compensated and so that it can be, seen as, also the driving force for this feminist movement, and also to just see young women as critical partners within organizing because of the labor that they bring forth within our feminist movement. Yeah. Thank you so much.
Thank you, Nancy. And on your last point, there's someone on this call called Precious Trisha who wrote a piece around who washes the feminist dishes. And I don't know if she can share that piece. And it really brings out the invisible labor even within feminist movements, because we recognize and talk about social reproduction and unpaid care outside of our movement, but also within our movement that exists. And so it's important that it is recognized and, yeah, so I hope that she can share that paper with us in the chat. And lastly, Clarice.
Okay, thank you, Juanita. So I was just reflecting on all the presentation. Like I started with the presentation on the community health workers, and what the writer was like speaking on is something that I was also reflecting on. I think I wrote it in the chat box, and it's common within Zimbabwe, the country where I reside in, where we have these community health workers. They are armed with uniforms. They wear their uniforms with pride. They have bicycles, and they navigate difficult terrains where specialized health workers like doctors or nurses who have critical skills do not even reach, but they are underpaid, they are not formally registered, and they are not like they recently they've been equipped with tablets to insert data, but they barely have an understanding of how to use these tablets and how to like it's a whole process for them, and yet it's now taking more of the time that they're supposed to be using towards reaching out to the communities. And that's one other thing. And then the next thing that I wanted to talk about is like labor. How do we define the scope of workers? Do we limit it to the scope of employees? Because right now I work with youth entrepreneurs across like who are into the green jobs economy, who are contributing data like innovation. The word is innovation within the food value chain, the green economy, and everything. But they lack the technical information on how to adequately legalize their businesses and interventions. It's as if the government is deliberately taking away information that is supposed to be accessible for youth entrepreneurs to be like in a competitive advantage with other big companies within the field. And it also compromises the work of young people. And along the line, these young people lose the intellectual property rights of their innovations, lose their ability to really stand for their innovations, and they end up deviating to other roles because they did not excel and were not afforded the right equipment, tools, and information that can help them improve their businesses, which is also work. We have youth and women. So it also aligns with the critical gap within the digital skills, because most of issues to do with digital, how to navigate digital spaces in a digital world, there's a rev across African countries with regards to like digital spaces and everything, but there's very limited, what can I say, opportunity and resources that actually allow young people and women entrepreneurs and women business people to navigate these digital platforms. And this further marginalizes the critical work they are doing. So that's what I wanted to contribute. So it's like exploitation of innovation through digital platforms. Yeah, thank you.
Thank you so much, Clarice, and I'm glad you are on the speaker lineup for Thursday's session. So I'm sure there'll be more room to expand on that in terms of entrepreneurship, innovation. I'm sure feminists here have things to say around that. But thank you for your intervention, and I hope one of the speakers is able to talk about that. So I will hand back to our lovely speakers. Our time is really fast spent to just share with us. Maybe you can answer some of the comments, questions, reflections, and also your closing remarks. So We'll start with you, Wangui, then Teto and Fatima.
Thank you all. I've really learned so much. So I appreciate how generously everyone has shared. If I can speak to Emanuela, I think one shortcoming of the great presentations today was we didn't talk enough about young people who are 77%, more than 77% of our population. Of course, this all intersects, but I'm grateful to you for emphasizing the role of young people. And I would say from my, I'm not going to say geriatric, but from my perspective, in one sense, this demographic of powerful young people is limited by the role, the title you're given as digital natives. So at once, it's a way for you to seek other opportunities. But then as you've discussed, the work in that sphere is alienating, is fragmented, you're unable to organize, is poorly remunerated. And so I think that's something we need to think about, how these narratives then that ostensibly celebrate you fix you into a labor demographic where your labor is not valued. And thank you for sharing. In terms of the community health volunteers, I need to say that initially they were called workers, and then one community health promoter told me, no, they removed the title workers because then that would mean they have to remunerate us. So we moved to becoming volunteers, and now we are promoters. And one thing that's clear, I think a lot of people have talked about minimal labor standards, including minimum wage. If the government itself can remunerate or barely remunerate promoters at almost 6 times less the minimum wage, then they don't really care about these standards. These standards are to take to ILO meetings or to take to other formal spaces, but they obviously don't, if in all of this ostensibly social inclusion for whether it's work for young people or work for community health promoters, they don't actually really care about adhering to their own labor laws. And I don't know how we get around this problem. The last thing I'll say, and hopefully I'm speaking to these different questions, one thing I didn't emphasize is that for not only is these tablets additional labor for this datafication of their process, additional labor for them, but they're also faced with a reality where they don't have electricity. So this government is giving them tablets while they don't care about where they'll charge these tablets. These tablets probably cost more than they will earn in 2 years. And so there's a very big disjuncture in the Hollywood tools they're given for their work and their realities. And that just shows not only the value of their labor, that they're fixed in place for these techno-scientific developments, but that the government doesn't really care about improving their own conditions. And finally, to speak to Clarissa's work, this also reminds me of the labor of waste pickers who are celebrated as, in this age of circular economy, they're celebrated as, frontline workers. But the reality is most African waste pickers, and as you know more than me, they're really in precarious conditions, doing precarious labor. And I think I just wanted to make that parallel to maybe connect with your work. But we can see that all of these celebrated narratives, whether it's green transition or fintech or healthcare, they all need that because they build on colonial relations, they further exploit the person at the bottom of that pyramid, or the people including trans workers, including queer people. Anyway, I'll stop there. Thank you.
Thank you, Angui. Over to Teto for two minutes.
We shall try. Thank you so much, Janita. So just to add on to the question asked by Clarice, and it's a very important question to ask. And I had inferred on it in my initial address that we have the differentiation of who is a worker and who is not a worker simply for legal entitlements purposes. And that's why it's very important that we get this right. That for as long as you are an independent contractor, you are a short-term worker, you work from a project to a project, you will not enjoy in a lot of democracies, and this is the case across the continent, the legal entitlements that would protect that who is deemed an employee, for example, in the labor law. So earlier on when Pat typed in the who had to leave in the comment section while I was speaking that of course the South African example is regressive in that the labor law reforms have now sought to redefine who is an employee. And she is correct that it is regressive because it still then excludes rather the worker who is simply, working from one casual project to another and freelancers and other groups. And there was another question also that I thought was quite important. Also, Helen speaks about the need for technology facilitated GBV research across the continent. I could not agree more. When I saw the work from Kapisa, I was actually quite impressed because they're one of the most, I think, advanced organizations and zooming in on this research area. I couldn't agree more. It's very important to do that. Then there was a question on the chat around from Janita Mbabazi who asks around pregnancy and what that means when you have to take time off to go and give birth in an algorithmic controlled workspace. Well, they just don't hire women. They really just don't hire women. And that's where the bodies question that came through was so important. They don't hire women. I spoke to a young man preparing for this talk who works in IT for a multinational. They work remotely, always have for the past 5 years. Now, I asked them, they're an IT support worker. I asked them, are the women in your team? He said, it took him a moment, of course, to reflect on this question. And he said, no. And he's like, how did you know? And I said to him, because it's shift-based work. And it's work that demands your attention 24/7. So how about we eliminate the person who we are still extracting from as society in the form of unpaid care work? We are now discriminating from them from the labor market simply because we know they have more requirements to exist than a man would typically, right? And I think just to bring it all home, recognition is very important. I think we can have many long conversations, but until we get recognition right, we'll always come back to what we could have done differently. Because recognition expands who counts as a worker. And that's why I said that that's the beginning of every question that we must confront as activists, as organized labor, that who a platform worker is a worker, the community healthcare worker is a worker. In South Africa, it took court action by an organized trade union to get healthcare workers or in what they used to call home-based care workers recognized as workers. Only then did that happen. So a lot of the work has to be multi-confrontational. It has to be legal. It has to be political. It has to be community-based. It has to be everyday advocacy using the same networks, the same tools that capital is using to do so. We just heard about the rise of the traditional wife. Indeed, that is not incidental. This is how organized capitalism works. Because the traditional wife is going to require the entire house groceries to prepare a meal. Of course, that benefits capitalism. and a whole lot of other regressive ideas that we've all considered we need to move from as a society. Second, protection, and this means that the rights must follow the worker and not the workplace. So whether I find myself in a mine, I must still be followed by the rights that protect my work and my right to exist as a worker. Whether I am online for 24 hours a day, I must still be protected. And that's what we need to ensure we see. Now, the last one, power. On power, it simply means that workers must be able to organize where they are. It can't be that you wait until you are in formal employment that you will enjoy the benefits of these grand legislations and grand protections that we really go on to. I mean, at the ILC, the stage is filled with a lot of Africans who are talking about this breakthrough, that breakthrough, that breakthrough, when in reality, when you come back home, it's the opposite. And I was listening to Auntie Ghislaine talk about how we need to ratify conventions. You go and you ratify those conventions and you come back to Africa where there is no supporting legislation in your home country. So I think we really need to turn the pyramid upside down and use what we call an inverse pyramid in journalism and start asking questions from the bottom up as opposed to where we are. And maybe then we'll see some way forward. I look forward to, of course, joining the rest of the sessions, and hopefully Juanita will send all the details we need, because this space is incredible, and it's been really great learning from all of you and hearing your perspectives and perceptions. Thank you so much.
Wow. Thank you so much, Tito. Thank you so much, Wangui. Thank you so much, Fatima. And thank you for everyone who has joined, who has contributed in many ways. This is really collective labor and collective work. And so I hope you enjoyed the conversation and the session as much as I did. Our next session will be on Thursday. And it will also be a launch of a journal that we worked with together with another organization on Pan-African feminist labor narratives. So please join us. And our last session will be on Tuesday next week. So whichever you're able to join, please do. But the session recordings are also uploaded to our YouTube channel. So I'll also share those as I continue to share communication. Thank you once again. Thank you to our interpreters, and I hope you enjoy the rest of your day.
Thank you, everyone.
Thank you. Thank you, everyone. Have a great afternoon.
You too.